Welcome back to this session. Remember, we are still dealing with pharmacokinetics and specifically absorption. But under absorption, we want to talk about what are the determinants of release of a drug from a pharmaceutical preparation. Remember, several drugs come in different forms with different additives. Yeah. So what are some of the things that help or determine the release? Yeah. And how is release affected by some of these things that make up or comprise a pharmaceutical preparation? Now, the very first one is what we refer to as the drug form. Remember, we said a drug form, it can either be a tablet, can be capsules, it can be syrup or elixirs, or a cream or an ointment. So that is what we refer to as a drug form. Now, capsules and tablets usually delay, they delay the release. When we talk about release of the drug, we basically mean the active moiety or the active ingredient of this pharmaceutical preparation. So we are saying that when a drug comes in either capsules or tablets, there is an initial delay of release of this drug as it tends to dissolve in solution. But then after it has dissolved in solution, then we have what we call a rapid release. That is why you have some tablets, they are called extended release or rapid release and all that. So that is basically what tablets and capsules do. Now, with solutions, you basically have no delay. You don't have any delay of release of this drug. It is released immediately. Now, with the creams, ointments, and suppositories, we do not have a delay in release. However, the release of the active drug or the active ingredient or moiety is actually slow. Those are some of the factors or some of the drug forms that will determine in which we either see a slow release or an active release or even a delay in the release of the active drug. Now, the other one are what we refer to as the additives, or what we refer to as the excipients of the drug. In other words, what has been added in this drug. Now, we can see that there, in case a drug has binders are basically those things that hold the drug molecule or the drug together. And so you see a tablet, the different, it's held together by what we refer to as binders. And so binders, they decrease the rate of dissolution. Binders, lubricants, and coating agents, these decrease the rate of dissolution of this drug. And so that necessarily means that we shall have a delayed release. But once we have dissolution, then we have a fast release of this drug or this active moiety in solution. And then disintegrants, there are some drugs that come with special disintegrants that are mixed with them, or that have to be mixed with them. And so disintegrants, basically, they increase the rate of dissolution, and for that matter, then, they increase the rate of release of this active drug into solution. Now, the variable ones, which have a variable effect on the rate of dissolution, are what we refer to as the diluents, the coloring agents, or even the flavoring agents. Now, the manufacturer's parameters also will affect the rate of release. Like, for example, tablets, compressed tablets and hard tablets, basically they dissolve slowly. I don't know whether you have seen some tablets and they are really hard when you touch it, it really feels hard. That necessarily means that the rate with which they release the active drug moiety is actually slow. And then the shape of the tablet. Round tablets dissolve more slowly compared to other shapes of tablets. And then the size, the tablet size, of course, large tablets will dissolve slowly compared to what we refer to as the small ones. Like, for example, compare a tablet of azithromycin versus a tablet of prednisolone. These are two different tablets that have a great variation in size. That necessarily means that a small one, like for example prednisolone, will be released slightly faster compared to a big one like azithromycin tablet, which is quite large, so it will be released. The active moiety will be released slightly slower compared to a smaller tablet. Now, lastly, it is very important for you to appreciate what we call a plasma concentration versus time profile drug, or the time profile for a drug, following what we call an oral dose. Now, the drug that you see before you has, especially this one that has been drawn, as you can see, the axes, we have what we call the time in hours, and then you have the concentration of the drug. Now, if you give that drug orally, then we expect that it starts from the concentration will start from 0. The plasma concentration of that drug will start from 0, and then it will rise steadily. It will rise steadily until a time where it will not rise anymore. Until a point where it cannot rise anymore, and then it starts falling steadily. Now, there are quite some important things that I want us to look at here. And basically, when you have that time, there is what we call the minimum effective concentration of the drug. So at this particular point, like for example, if you're taking the drug for maybe pain management, like just imagine you're taking paracetamol. Now, if you're taking paracetamol, all the drug does not necessarily need to be absorbed for it to start working. No. A certain amount or a certain minimum amount is actually will be absorbed, and then it will start working. Now, that is what we refer to as the minimum effective drug concentration. In other words, it means that at that point, even if the entire drug has not been absorbed, it will start working. So that's what we refer to as the minimum effective drug concentration. Now, when you draw, when you extrapolate as far as the time on the x-axis, when you extrapolate along that curve, as far as the time is concerned, we refer to that as the time of onset of action of this drug. So that is what we refer to as the time of onset of action of this drug. And then, of course, that drug will not work forever. A time will come when it will terminate its action. In other words, if you took this paracetamol for pain, a time will come when the pain will have to come back. That is why it is recommended, that you follow the dosing. If you have to take it 3 times a day, then you have to do the same. Because a time will come when the action of this drug that you're giving will be terminated. And that is what we refer to as the termination of action of this drug. Now, if you observe critically, that point at which the drug or the curve is rising, at that point we are actually absorbing the drug. We are actually absorbing the drug, as you can see. However, you do not absorb forever. A time reaches, that absorption reaches a maximum, or what we refer to as the peak. And then after that, the curve falls because this drug is being eliminated from the body. Yeah, of course, eliminated from the body by the kidneys. And then it falls steadily. Now, that is what we refer to as the elimination. Now, this shaded part here is what we call the duration of action. In other words, that's the time it takes. From the time of onset of action to the time of termination, that duration, that is how long it takes. And so we refer to it as the duration of action of the drug. Now that is the same reflected to this other graph, as you can see. Now, ladies and gentlemen, in a nutshell, we have been talking about what things determine the release of a drug from a pharmaceutical preparation. And we talked about things like additives, we talked about the drug size, among others. And finally, we talked about what we refer to as the plasma concentration versus time profile for an orally administered drug. And we saw some parameters there, like onset of action, termination of action, duration of action of the drug, absorption, elimination, and the peak level at which a drug cannot be absorbed anymore. When we come back, we shall look at other general terms that are actually very, very essential as far as absorption is concerned.